Hello, good morning. Welcome to this week's staff brief. I'm Paul Robinson. I'm the Chief Executive here at Sherwood. Thank you for joining us. And today we're going to cover the upcoming industrial action next week. And Dave Selwyn, our Medical Director and Deputy Chief Executive, will give us an update there. We'll also cover our recently updated people strategy, and Rob Simcox, the Director of People, and Debbie Kearsley, Deputy Director of People, will give us an update on that. We'll also be able to see a video that people across the trust have been contributing to. Helena Clements, our Climate Action Lead, will talk to us about Clean Air Day, which is on the 15th of June. And then Katie Townsend, our Clinical Lead Dietitian, will talk about Dietitians Week, which is this week. In the background, Jess Baxter is helping us all through this and keeping us all to time and providing all the technical backup. And please use the chat function to raise any comments or questions that you might have as we go. I'll kick off with a few general updates. Firstly, yes, we've got some new opening hours for Costa. So due to public demand, just the feedback that we've received, Costa Coffee has now revised the opening hours and are reopening throughout the night. So they're not open 24 hours a day, but they will be open on an extended basis. So Monday to Friday, that will be from 7:30 in the morning till 6 p.m. in the evening, and then reopening at 8:30 in the evening through to 6 a.m. in the morning. And on Saturday and Sunday, slightly reduced opening hours. So on Saturday and Sunday at weekends, they will open at 9 a.m, close at 5 p.m, and then reopen for that 8:30 evening slot all the way through to 6 a.m. in the morning. So the thing to remember there, I think, is for 7 days a week, Costa will be reopening at 8:30 in the evening and going through to 6 a.m. in the morning. So good news there. Not so good news on the car parking front. So we know that we've had some challenging days over the recent weeks in the car park here at Kingsmill. And by just after 9 o'clock this morning, it was an unprecedented issue that every car parking space was actually taken across the whole site. So staff have been directed to park in areas which under normal circumstances you wouldn't be allowed to park. So for example, on double yellow lines. So ticketing today will not be undertaken on site unless you're parked in areas that are dangerous, such as ambulance bays or on the double red lines that you'll find in some areas. So please don't park on double reds. Please don't park in dangerous places such as ambulance bays. Otherwise, you will be ticketed. So this will only occur when directed by car parking high turn stand. So please don't think that our relaxed view on ticketing today will become business as usual and the accepted norm on days when there is capacity, only on days when there is that high demand. And we'll keep people posted and updated on when that happens. Car parking is always a highly emotive subject, so please remember to act in line with our care values and be respectful of all colleagues. If you've got any concerns, please contact the car parking team. And Jess, I think you've got some contact details for the car parking team to post in the chat. Thank you for that. Okay, lastly from me, it's Carers Week. It's Carers Awareness Week this week. For those who joined Staff Brief last week, we had an update from our staff network, and hopefully you got a good flavour of what that network's around. So whether you are a carer, whether you're unsure you're a carer, you support or manage a carer of a friend who is a carer, this week is it's a week of celebration to celebrate all carers, what they do, what it's really like, and to talk openly about what helps and what doesn't, and what we can do as a trust to support carers too. So here at Sherwood, we're passionate to support you as an unpaid carer. We heard last week from Corinne and from Tracy from the Carer Staff Network, and the network's a place where you can talk openly about what it's like, how we can support you. It's also about supporting our family here at Sherwood Forest to signpost to places that make things a little easier. So if you've got any questions or comments or whether you would like to join the network, please contact sfh-tr.carers.support@nhs.net. And Jess has just posted that in the chat. Thanks, Jess. So please contact that email address for any support that you need or you'd like to play a part in the network or be an ally for others. Everyone is welcome. And during this week, during Carers Awareness Week, there's a range of things happening across our 3 hospital sites. So firstly, today on Tuesday the 6th of June, our staff network lead will be at Mansfield Community Hospital between 1:30 and 3:30 this afternoon. Tomorrow, Wednesday the 7th of June, there'll be a carers stall in the Kings Mill, so in the KTC between 10 AM and 2 PM. And on Thursday, that stall, the carers stall, will be in the glass corridor at Newark Hospital at the same time for frames 10 in the morning until 2 in the afternoon. Okay, so that's my general updates done. Can't see any comments coming in, so I'll hand over to Dave Selwyn. Dave, we've got upcoming preparations for the industrial action next week, and I know you want to give us a flavour of how that's happening. Thanks.
Thanks, Paul, and good afternoon, everyone. I guess it's disappointing that negotiations are broken down between the British Medical Association and the government, and many of you will be aware that the BMA have now announced that a further period of industrial action, which is a 72-hour walkout by our junior doctors, commencing 06:59 on Wednesday 14th of June and running through to 06:59 on Saturday the 17th of June. So straight 72-hour stretch there. As far as I'm aware, there are no ongoing talks between the government and the BMA, and you'll be aware that the BMA starting position has been around pay restoration, and my understanding is that the government offer was similar to that to the Agenda for Change position, with around about 5% increase in a lump sum, which I think was around £1,500 or so backdated, and that was rejected by the BMA. And the BMA junior doctors have stated that as a result of this breakdown of talks, that they intend to hold a minimum of 3 days of strike action per month ongoing. Again, they have a mandate, so they're allowed to hold industrial action for a 6-month period from when the ballot was held, and they have a mandate which I think lasts until just about the end of August, so they no doubt will be looking to reballot if things can continue. And I guess I'm sure I speak for all of us when I, sincerely hope that and sincerely ask that the government and the BMA commit and recognise each other's position, commit to having some meaningful negotiations around this, and move on their various stances, and we can hopefully get to a better position, because there's a huge impact for our patients in all of this, and there's a huge impact on our colleagues within this process, and of course there's an enormous cost as well to us as an organisation. So notwithstanding all of that, we've obviously started the detailed planning for this up and coming industrial action, and rather disappointingly, one of my colleagues this morning in our medical managers forum, one of our heads of service, sort of stated that it's rather becoming almost as business as usual with these strikes, which is a sad reflection of the times. So the divisions are working on staffing rotas to provide emergency pathway support and inpatient care, as we've done previously in the previous 2 strikes, and we'll build on the experience that we've got from there. But what I can say is that whilst we're at the early stage of that planning, we haven't really identified any significant concerns. It's different this time from the last strike, because that was over the Easter period, and there was quite a large amount of annual leave that was already taken at that time. So this is out with a normal or heavy annual leave period. So I would hope that we are able to start our rotas going forwards for this action. In terms of the extra offers that we're doing, there's pretty much similar to previously. So we'll have a bespoke digital offer. So for those people who are struggling with their IT access or need a little bit of help to do that, then we have some bespoke contact we can give. I'll put it in the chat, but it's utilizing Morgan, and we'll get that help to you. The divisions, as I say, are working on the detail of what the impact will be in terms of for our patients. We've got to balance the sort of pragmatism about staffing the rotas and also taking down planned activity to allow that to occur. We probably won't notify all of our patients until early next week, I would think, in the hope that there's a bit of divine intervention maybe over the weekend, but in reality I think that's unlikely. But we will then go through that process, but that clinical activity that we need to stand down, as we've done before, we will do to support those pathways. We'll utilise for our junior doctors, we'll utilise our logging on QR codes as we've had before. We've agreed to support the wards with additional phlebotomy rounds as we've done before. There'll be extra radiology cover. We've got extra patient-facing pharmacy cover. We've put on extra critical care outreach overnight, and we put the medical emergency team overnight as we've done previously before. We've asked our paediatric colleagues to support the front door, the paediatric ED via the CAU provision, and we'll remove the TTO cutoff that pharmacy have been running with during this period. In terms of pinch points, the only two I'd sort of highlight at the moment probably is one around anaesthesia, where we have a number of staffing gaps, and we tend to use our anaesthetists to help troubleshoot, particularly overnight, with those medical emergency teams. And we've got some pinch points in our EAU as we've had before, but we'll work through that over the next few days or so. So hopefully we'll get to a good position as we've done it before, but notwithstanding that it's disappointing that we're having to go through this all again. I'll probably bring in Debbie in just a second to maybe just update around the wellbeing offers. It's great to see the extended hours for Costa. I hope that will be received positively to support our colleagues overnight. But I'll bring in Debbie, and then Debbie, I might ask you to just touch on touch points with our junior doctors and consultants as well. Thanks.
Thanks, and good afternoon, everybody. So in terms of what you'll see on the day, like previous strike days, you'll see that there will be a picket line, as we call it, down at the front of the hospital, off the site, but at the front of the hospital, outside of the front of the KTC in the main entrance. As senior leaders, we will go down and visit the picket line. On previous strike days, it's been really a nice atmosphere down there in terms of what they're trying to achieve. In terms of the wellbeing offer, the Trust has well-established wellbeing offers which are available throughout the strike, and not just through the strike, are available at all times. And our wellbeing offers are well advised and well publicised on the Trust intranet, should anybody want to access those. In addition, there'll be wellbeing walkarounds from leaders and from the People Directorate to ensure that everybody's okay and to offer that support where we can. And also we are ensuring that basic needs are met in terms of some food provision at the Kingsmill site. That is up on level 6, and that is a dedicated rest area for individuals to go and have some downtime, but also to have rest, rehydrate and refuel. And we are just working through where that will be located on the Newark and the Mansfield Community Hospital sites. Also want to point everybody to the Trust intranet, where we have a significant amount of information and FAQs in terms of what does strike action mean, and some practical information in terms of strike action is all available on the intranet, and we review that on a daily basis and update accordingly. In terms of the junior doctors and the consultants, just to give an update where we are, we have had notification from the BMA that they are currently balloting our consultant workforce, not just at this trust but in England, in relation to strike action, and that is regarding the pay award and pay restoration. That closes on the 27th of June, and we will know the outcome either on that day or the following days following that. And we have had some notification from other trade unions that they are also balloting. The RCN and the Society of Radiographers are also balloting for strike action, and their results are due towards the end of June, so we'll keep individuals updated on the outcome of those. Thank you.
Okay, thank you. Just posted two signposts there, one to the dedicated industrial action intranet page, and also Morgan's provided his email address if you need digital support or training for next week's action. And as you were saying, Dave, whilst we support the right to take action that anyone has, we want to see this issue resolved as soon as possible. The huge impact on patients, we have to step down activity, and therefore patients wait longer. And there's also a huge impact on our colleagues. You know, people are stepping up, they're out of their comfort zone, and we will provide that support, as Debbie's just suggested. But there's a huge impact, huge toll on the organisation as a whole. We want to see it resolved as soon as we possibly can. Okay, thank you for that. It may be that we use next week's staff brief for a further update on our plans, but Dave, I'm assuming that you didn't give a comment on how those plans are progressing, whether we're gaining some confidence in a successful delivery. But you did make I know someone's made a tongue-in-cheek comment around it's becoming business as usual, and in that context we have some plans that we've rehearsed and have worked well in the past. So I'm assuming therefore that is this week's point of work, that'll progress as we have done for the last two industrial action phases, and that we've learned some lessons around how things can be tweaked. So just give an update as to how this week will pan out, and when we'll be able to provide a little bit more information as to what's happening next week.
So we've got to around, I think around 80% or so of the rotas we've got names against shifts. It's just finalising those last aspects. So that's really what the divisions are working for, and what we've asked our divisions to do is to give us that detail by Thursday. So, you know, as you can imagine, this is an enormous undertaking, and I think it's important to pay tribute to the work that the divisions are doing around this, because actually it is all consuming, because there's the aspects of running through the planned care list, the waiting lists, and preparing to notify patients about which clinics may be going down, or which theatres may be going down, or which procedures may be cancelled. So it's an enormous amount of work. And then there's the process of planning to rebook all of those slots. And then at the same time, there's the massive amount of detail around staffing rotas, agreeing who's covering what the impact that will be. And so it consumes the divisions. And this is the bit, and I know I mention this to the trust board every now and then, but whilst it's 3 days industrial action, we do about 2 weeks planning beforehand. We have a week of the strike, and then we take about a week to sort of decompress and reflect on it. So it's a huge impact for us as an organisation. Of course, we're not unusual in this. This will be occurring across the country. So we're well into those plans. The divisions are working on them. What they need is they just need the time and the space to be able to get on and do that. And we'll finalise those plans on Thursday this week. And I'm happy to bring back an update for you next week if required, Paul.
Thank you. Thanks, Dave. Thanks to everyone who was involved in that hard work this week, putting those plans together. Okay, I can't see any questions that come through on this topic, so we'll move on. Move on to Robin, the revised people strategy. I was delighted to see this come to the board of directors last week, so I've got some advance knowledge of this. But I'll hand over to you now, Rob.
Thank you, Paul. Good afternoon, everyone. Delighted as ever to be on Team Brief. I guess where I'd like to start is a bit of a flashback. So 12 months ago, I described to Team Brief, I described to board also around a framework for our people, a framework for you, I guess, in regards to how Sherwood embrace some of that national people agenda. But localise it with a narrative that people could understand. I guess be embedded, but more importantly, could be spread. What that's become is our approach, I guess the Sherwood way, around supporting our people to be the best that they can be. And today, or should I say this week, marks kind of year one of that. And we've done some really good stuff. I could probably spend all day, Paul, just talking about the highlights, the achievements that myself, Debbie, the team I lead, but more importantly, our people have achieved across that year. What we have been able to do is pull a video together, and I'll bring Jess in a moment just to play that video that really brings our people strategy to life, that describes some of the impact that it's had of our people. And after the video, Debbie will talk about year 2 and year 3. I think it's fair to say our people strategy was written at a time when we didn't potentially foresee some of the challenges we've experienced over the last 12 months. So Dave's eloquently talked about industrial action. We're going to be moving into the 3rd wave of that. So we've took the opportunity to reset, but I guess more importantly, refocus what our strategy is about. It's an enabling strategy for our people, for you as individuals to be the best that you can be. So I think I'll pause there. Jess, if you couldn't apply some magic to this wonderful video that's been pulled together, that'd be great. We introduced a strategy for the vision of our strategy. Sure, we support our people best they can be. Delighted to talk to you today about the importance of our strategy, and more importantly, the importance it's had on our people. We've arranged for a number of people today to talk about how important this strategy is.
The Trust Care values are important to me as they are the heart of everything we do daily. They are essential for being part of and leading a successful team. We always respect and involve her in every domain that will efficient care that's delivered. We always communicate together the best that we.
So having a team in the past year, from a very selfish point of view, actually those care values are a really, really useful tool in being able to look at the individuals as they come through the door and say, actually, do they reflect the people who work here at Sherwood? Are they setting themselves up to provide the best possible care for our patients?
We work in partnership at Sherwood Forest Hospitals to ensure that the Trust Care values are supported and embedded in everything we do as staff side leads. Through partnership working, we endeavour to everyone within the trust treated fairly, effectively, inclusivity, why they are so important.
Is really important at Sherwood Forest Hospitals. A recent example for me is a colleague of mine. Her workload, it was being affected personally and professionally in every part of her life. She contacted the VivUp team. They did a few sessions with her, and because of that, VivUp did a report to management, and management acted upon that almost immediately. And a glimpse in her personally and her life, really.
1990s. I've just taken on a role as the Health and Wellbeing Champion, so I'm excited to start on that for the department. I work with a lovely team. We're like family, and that's what keeps me coming.
A couple of weeks ago, I won the Outstanding Individual of the Year award for corporate admin in the 2023 World Admin Day Awards. It was a really nice surprise. 2 members of my team also received nominations, as well as some of our department. It was really many of us could recognition from our colleagues to feel like we belong.
And being a Muslim doctor in the trust, we have a large number of staff who practice Islam. And during the difficult time, even the COVID, the trust has been really helpful. And we are one of the trusts which has been providing halal food for all the Muslim doctors since the last 2 years. We were welcomed during the time of our Ramadan and Eid by our faith center staff. So I can't ask more than that.
I was approached to apply to ship in the health and safety as a way of training whilst on the job. Nice to see that the trust is in development through the. So I started in 2021 later in the hub, and we weren't too sure what was going to happen with the programme. So it was great that the opportunity for the apprenticeship came along, that I can learn and develop my career at Sherwood Forest Hospitals.
Education is a passport to a better future. Attending the Clinical Leadership Development Program and the Windrush Leadership Program, which greatly assisted me in finding and using my voice and promoting a culture of inclusivity and equality for all. All of these trainings have supported manager and the trust. Because of this, to provide an efficient care patients in acute medicine, in urgent and emergency care.
New York Theatres are having a new theatre TIFF project, and they needed a clinical educator for the department, so that's why I'm now in post. My background is I'm an operating department practitioner. I just wanted to develop my role as an ODP, as I enjoy helping others and helping other people develop as well, and the clinical educator post I thought was perfect. It's helping other people again to get skills.
Really lucky to have a manager who allows flexibly with my childcare. My wife works in the NHS, and it's a big pressure on us both to ensure that we can be present at home. I also like it when I work from home, that ability to be able to put things down, go for a walk. If I want to go for a run on my lunch break, I'm really supported in doing that, and that helps my overall general health and well-being.
I'd like to take this opportunity to thank you all, our colleagues and partners who have supported the delivery of the People Strategy 2023 for helping to shape tips and priorities next 2 years. It means a lot and unnoticed. You have supported us, member of one of our staff networks, and listing as a wellbeing champion. These are just a small handful of examples of how you can get involved within our people strategy. I'm confident that our teams will continue to support divisions to provide high quality, safe care for our patients and to ensure that Sherwood is a great place to work and to belong. We look forward to working with you all as we enter year 2 of our people strategy. Thank you. Sorry, I'm mute. So thank you, everybody. In terms of the video, really proud to show you that video, but I do believe there may have been some technical issues in terms of the video. So comms will put the link in to the video on the chat, and also it will be in this week's bulletin. So really proud to be part of the people strategy, and in terms of our resetting of the strategy for years 2 and 3, we've focused this around 4 key areas which align to the National People Plan and the People Promise, and that is looking after our people, belonging in the NHS, growing for the future, and new ways of working and delivering care. And some of our key focus over the next year will be growing and focusing our wellbeing offer, including implementation of our trauma risk management and looking at our violence and aggression agenda. We also look at our reward and recognition and growing our staff networks. We've heard through our team brief the amazing work that our staff networks do. This week is one example of that with our Carers Week. Growing for the future, we'll be looking at how we develop our talent, having talent management and growing our apprenticeship. That's something the Trust is committed to. And the new ways of working is about how we are supporting some of our trust-wide initiatives such as CDC, our Newark TIF, for example, and becoming more digitally innovative in how we deliver our people services. So they're just a few key elements, and the people strategy will be on the HR intranet for you to have a look at. It's important to know how we've reviewed this and how we've taken this forward and developed this is around engaging with you, our people, our clinical and non-clinical colleagues, and this reflects what is important to you and how we can support you to be and empower you to be the best that you can be. So it reflects about what is important to you, our people, and how we can support you in your careers and your working lives here at Sherwood. Rob, is there any final comments you'd like to make?
I suppose what I would be remiss of me is perhaps not acknowledging the wonderful stories and time that people put into the creation of that video. There's a lot of unsung heroes that go on behind the scenes, whether it's our comms team, whether it was Beth, as in Beth Hall, who made some of that happen. None of it was scripted, it was spoken from the heart, and I think it's fair to say we also had quite a number of individuals that didn't meet the first cut. What might be useful, Paul, is we are looking at introducing a variety of videos that can be used through orientation and through onward promotional activities around working at Sherwood. That is part of the reset of the care values, which is a piece of work that we're building on at the moment. So there's probably a spoiler in there somewhere about perhaps myself or Debbie coming back in a few weeks just to update that further.
Thanks, Rob. Thanks, Debbie. Such an important piece of work. You know, I said that so at the board of directors last week. I think everyone was delighted to see this as a framework for how we support everyone in the organisation and empower to be the best that they can be, and the importance of the care values and how we treat each other with kindness and respect. So it's a framework for everyone to work within. It's not a document that is for the people directorate to look at, to gaze at lovingly on their shelves. It's something that everyone can get involved in, and it'd be great if you could return in a few weeks and talk again about our care values. That'd be fantastic. Thank you. Okay, so I can't see any questions, so we'll move swiftly, Helena, to Clean Air Day, which is the 15th of June, I understand.
Indeed it is. Thanks, Paul. So I spend quite a lot of time thinking about joining the dots, as I call it, and I think some of the things that we've talked about today are all relevant to Clean Air Day, which is next Thursday, the 15th of June. Unfortunately, it is during the industrial action, which may impact on people's ability to get involved with this, but we still have to get to work, so I hope that won't be the case. So we know that air pollution is a very significant factor in affecting our health, particularly respiratory illnesses and asthma. Children are particularly vulnerable to that, but it also impacts on cardiovascular disease, stroke and dementia. So it's something that's really important. And, you know, we in all of our cities, our air quality is not great. So it's a National Clean Air Day, and there are lots of things happening across the system and across the country. And we're going to be doing a number of things Ideally encouraging people to cycle to work if they can, if they live near enough, walking to work of course, and using public transport and leaving the car at home. And hopefully that will help thinking about my dots joining the car parking issues that we're currently facing. So leaving the car at home is a potential for that. The other thing that we can do is car share. This is something that went out of the window really because of COVID, but is now possible again. And certainly I've car shared with a few of my colleagues, and it's been a great opportunity to talk about clinical issues, talk about departmental issues, or just social chit chat as well. So I've really valued those times personally, and I'm really pleased that we can do car sharing again. So that's one way to get around it. Lots of people live too far away to cycle, and I completely appreciate that. And in fact, what my strategy will be is to join up with colleagues at Ransom Wood, so sort of come halfway to work by car and then get my bike out and do the last bit. So there are a number of different things that we can do, which will reduce our exhaust emissions, I guess, to keep air clean. So there are quite a few people across the trust who've been thinking about this, part from the climate action team, from the wellbeing team, and look out for comms around that in the next week. Some people aren't going to have that opportunity, and I totally understand that, but there are other things that we could do to contribute to Clean Air Day and clean air generally, thinking about replacing some of those nipping in the car to the shops, maybe walking or cycling now and again would be, it's good for us, it's good for our physical and our mental health, as well as reducing our admissions. And the other thing I was thinking about was a school run, which I think is something that has become very much embedded in people's lives and often involves cars, and you often see that a whole lot of cars outside primary schools and senior schools, and I think even if you can't come to work in a less in a car, thinking about how the school run might look is something worth thinking about. Again, I know it's not always possible, people have complicated lives and drop off kids on the way to work and things like that, but just at least thinking about that. I've also been thinking about, in terms of clean air, cars idling, and I've just asked the question today from our colleagues in EMAS about the rules on ambulances idling, but and I think they're pretty good, and Richard Clarkson was telling me, well, the turnaround time at Kingsmill is so fast in general that the ambulances don't spend time sitting there, but hopefully as much as possible we need those engines to be turned off, and that's true in the pickup area at the front. So I'm thinking about what more comms we can do about that, because every minute that we're not got engines ticking over, we get a bit less pollution going into the atmosphere. So Clean Air Day is on Thursday the 15th next week, but it's something just to bear in mind for every day, and just think about how we can do fewer car miles. Really, I've been on leave, but I was really pleased to see that the bus route is now coming through the hospital, hopefully to encourage our patients and staff to use public transport rather than the cars where possible. So that's Clean Air Day, and look out for any comms on that. It is about our well-being. I'm very minded that our staff, there's more than 8,000 of us. When we make small changes, it makes a big difference. And I think it's really important to remember that all of the things that we do count, and we are the community and our patients. And so looking after our own health looks after the health of our community as well. So really, really important, everything that we do here in terms of that health, well-being and climate action. So that's it from me. I'm hoping to get some comms out around the Clean Air Day. If you do something different that reduces your emissions next Thursday, do take a picture and tweet it or share it on Instagram. It'd be really nice to see what you're all doing. So yes, that's all I had to say. Thanks very much, Paul.
Thanks, Helena. I'm always really pleased that you joined the dots for me. you know, and because these things are obvious but only when it's pointed out to us that reducing our use of, I don't know, our cars for next week, so we need to plan how we do that, how we reduce that carbon impact for next week, and provide cleaner air on Clean Air Day, but not just on that day, but how that then impacts on how healthy we are, and actually impacts on the health of our community as well. So I always hang on to every word, because joining the dots is exactly the right thing, and something that I think all of us forget when we hear these things in isolation. So I really think I'm really pleased you were able to come on today to give us that heads up about next Thursday, because there is some things that we have to do and plan to do for that day that then we could adopt into our normal daily lives. So thank you. Dave, you wanted to come in?
Yeah, I was just going to hijack the climate agenda just slightly, and I'm sure Helena will allow me a bit of latitude. So just for healthcare is so important in this discussion. So there are a number of publications that are starting to appear. I'll put them in the chat or give them to Jess, but there's the Green Theatre Checklist, so we can actually try and reduce our waste and the impact that we're having in terms of the climate with our operating. There's now one just come out last week around moving towards a net carbon zero intensive care or critical care unit. All of us have some role that we can play in this, and it's just encouraging colleagues on this call to just think differently and to really get involved in this. I hope that helps, Helena.
Absolutely great. Yeah, thank you. And just to add that this morning I had a meeting with Richard Clarkson in the ED, looking at their sustainability work that they want to do. And what's so nice is that it's not me pushing them, they're asking me for help, which is fine, but they're coming up with ideas and things to take forward. And so, you know, this is all of our jobs, and as individuals and as part of this trust, and very much part of that people strategy and the wellbeing strategy as well. So yeah, I'm more than happy to join dots and have people join the dots for me, because I don't know everything. So yeah, thank you, Dave.
Thank you. And just before we move on, we had a couple of comments on this item. So fantastic ideas. Love the idea of driving part way and walking, running or cycling the rest. Particularly great for those of us who live a bit too far away to actively travel the whole route. And then a follow up, it also saves money on fuel. So another good reason to think about it as well. So thank you. Whoever contributed that, thank you. Thanks, Helena. So Katie, so welcome, Katie. This is your first appearance on Staff Brief. So Katie's our clinical lead dietitian, and she's here to talk to us about Dietitians Week, which is this week. So over to you, Katie. Thank you.
Thanks, Paul. Yeah, hi everyone, I'm Katie. I've done a few jobs. I've worked in the Trust for about 5 years, so I'm currently working as a dietetic advanced practitioner on our critical care unit. So thank you for having me here today, just to introduce a little bit about our department. Really, this week is Dietitians Week, so we wanted to tell you a bit about who we are and what we do here at Sherwood. So what is a dietitian? We're the only nutrition professionals regulated by law, so we're HCPC registered, and probably one of the biggest questions we get asked the most is why are we different from nutritionists? What's the difference? And as well as not only the regulation, the other thing is we're trained in the management of health and disease alongside nutritional science. We assess, diagnose and treat nutritional problems using the most up-to-date health and scientific research. And our job is then to try and translate that to our patients, so we can create achievable and practical advice for them using our communication and holistic assessment skills. Here at Sherwood, we're only a really small team, so there's only 11 in our department, and that is mostly dietitians, and then we have a dietetic assistant who works with us as well. We cover all areas across the trust, so from antenatal and neonatal care right through to the care of the elderly wards up on the 50s, providing inpatient and outpatient services across all 3 sites. So like all the clinical teams, we're pretty busy here. We've got 4 main specialist areas, so we've got paediatrics, diabetes, adult inpatients, and then critical care team. And then moving forward over the next few months, we've got quite a few exciting things in the pipeline, so we're hoping to improve our services. One of those is that we've got an oncology Macmillan dietitian starting, so hopefully that's really going to improve care for those vulnerable patients. We've also got some funding within our diabetes team for a transitional care post, so that's looking at supporting teenagers and young adults as they move from paediatrics to adult services. You may also have seen this year we've launched the food and drink strategy, so this is aiming to improve nutritional provision across the trust as a whole for our patients and for staff, with a big focus on promoting healthy options. And we've mentioned it a few times, but improving the out of hours food provision for staff as well. So that's why good news with things like Costa opening hours changing. We're also trying to play a key role in the trust sustainability drive. So one of our dietitians is joining Helena in the climate action team on one of her clinical fellowship posts, looking at food provision and sustainability of that across the trust, so we can try and improve that. Our role is to ensure patients meet their nutritional needs, and we all know access to food and nutrition is a basic human right, but that doesn't mean that it is always available and it's always there as it should be. Malnutrition has a huge impact on our ability to undergo investigations, treatment, recovery times, mobility, skin integrity, and it also has a huge impact on our patients' quality of life. And something that I know we've mentioned previously is the huge financial cost associated with malnutrition. So evidence published last year suggests malnutrition is costing the healthcare services about £23.5 billion a year. So it's a huge amount of money that we could be saving if we are treating and acting on malnutrition quicker. The average cost of treating a malnourished patient is about 3.5 times more than that of a non-malnourished patient. And 30% of our patients admitted to hospital are malnourished, and 15% of those turning up to outpatients. So it's a huge proportion of our patients that we could be treating and improving their care and long-term services for. So this week we're trying to celebrate what we do and raise awareness. If you follow us on Twitter, you may have seen we're trying to post as much as we can about who we are and what we do. You may have seen this morning we've posted a video that Amy, one of our very talented dietitians, has done. She's done a poem about the day in the life of a dietitian. So if you want to go and check that out, and hopefully throughout the week we'll be posting a little bit more, including some recipes and tips about sustainable eating and how people can get ideas in terms of the cost of living crisis and supporting themselves with cheaper food alternatives while still being healthy. We are about in the trust, so if you see us, we'll look for them. We've got purple lanyards and purple piping. So any questions, please come and ask us. But just to let you know a little bit more about what we do, really. Thank you.
Thanks, Katie. Thanks for coming along. Incredible, really, to hear the levels of nutrition patients present with that's astounding. But thank you for giving us raising our awareness as the role of dietitians, and the vital part that you play in our patient care, and also the options and conversation you're having with our staff and colleagues around healthy options and healthy options in terms of food, etc. So thank you for the contribution that you and your colleagues give. As I said, a vital part of the trust, and as you were describing your clinical and professional role in terms of patient care, really important that it's something that I necessarily wasn't aware of in terms of that registration. So thank you for making that, and also for signposting us to Twitter for the poem. I'll go and seek that out. So thank you for that and keeping that awareness running throughout the week. Okay, fabulous. So I think we've come to the end of brief this week. I haven't got any comments or questions in the chat that we haven't addressed. Thanks for everyone who's joined. Thanks for everyone who's presented today, to Dave and Rob and Debbie and Helena and Katie and Jess in the background. We are reviewing the frequency of the staff briefs. It may be that we consider moving to one every second week. We'll think about that over the next few days, and we'll keep you briefed on that. So hope to see you soon. Hope you have a good rest of the week. The sun continues to shine, although it's a little bit more dreary today. It'll come back, no doubt, and I'll see you again soon. Thanks everyone. Goodbye.
Thanks everyone.